For somebody who's tuned into this point, they're in that category of metabolic dysfunction. They have some extra weight to lose, but they're inspired and they're going to take action. For somebody that's going to adopt a lot of what we talked about today, what do you recommend? Jumping in cold turkey and just doing everything, or doing it at a slower pace and letting their body adjust?
It depends how ill you are. And, I see people with fatigue syndromes, and some of them are very ill. Because when you put in place these interventions, you get detox reactions, you get ketogenic hypoglycemia, you get keto flu. Sometimes if you're allergic to food, you can get allergy and addiction are two sides of the same coin. You can get withdrawal symptoms. So if you're otherwise completely well, and I'd just jump in and do it. But if you are sick, I think you have to do it more slowly. And the other point here is if people have been running on carbohydrates for all their life, and the vast majority of people have, then they will often struggle with a high-fat diet. And the reason for that is that the business of digesting fat is enormously demanding of energy. The pancreas has to produce a lot of enzymes, and the business of generating enzymes requires a lot of energy. And so if that person has been running on carbohydrates for forever and a day, then they're just not going to be able to produce the enzymes to digest that fat. So sometimes you just have to go into it slowly and maybe take extra pancreatic enzymes and maybe take some bile salts to help emulsify the fat in order to facilitate, fat, that you can tolerate that fat. But so the answer is it depends. And the sicker you are, the slower you go.
For somebody that is very enthusiastic, they jump in, they're very committed. How quickly can they turn this around?
Oh, very quickly. In a few days or weeks. As soon as you get into ketosis, everything just starts to fall into place. Your blood levels level out, you stop spiking insulin and adrenaline, the brain settles down, your quality of sleep improves, the fermenting guts, if you've got any gut symptoms, they disappear. And it's the start, if you've got any condition associated with inflammation, and I think much inflammation is driven by allergy to microbes in the upper fermenting gut, then the inflammatory markers settle down. And in parallel with this, put in place the detox regimes, because we're all poisoned, MSM and maybe metal chelation therapy. I'm increasingly coming to the view that we all have to do it all. Now, when I started work as a GP in the early 1980s, it was relatively easy to get people well with a simple elimination diets and a few supplements. Nowadays, it's much more difficult. It's much more difficult because most people are carbohydrate addicts. We're all poisoned. Underactive thyroids and poor adrenal functions and poor mitochondrial functions are very common. So, we just all have to do it all. And it always starts with diet and sorting out the upper fermenting gut and taking a basic package of nutritional supplements and then playing it by ear from there on. If you've got nasty pathology like cancer, then we haven't got time to muck about. You just have to dive in, and do the ketogenic diet ASAP, because you can't afford to waste time whilst the cancer grows. As you know, the difference between cancer cells and normal cells is cancer cells can only run on sugars and carbs, whereas our immune system, which is what we need to fight cancer, that can run very happily on fats. So it very much depends on the pathology, but these interventions really are the starting point to treat absolutely everything.
For somebody that wants to throw everything at this, how do you feel about some of these newer tools that are popular in the health world right now, like methylene blue, creatine, anything else in that realm that has a lot of momentum that people can stack on?
Well, creatine is very good for muscles. And again, keeping strong is very important. So yes, I'm very happy for people to take creatine. And for many, it helps energy delivery mechanisms. Methylene blue, I wouldn't do that straight away. Yes, it's a very safe intervention. It's good for energy delivery mechanisms, and it has good antimicrobial activity. So for some people, that is very helpful too. But people are always looking for the quick fix. And they come to me and they want me to say, you take this herb or you take that methylene blue, or you do this and you'll be fine. It's not like that. It's hard work. And, we're talking the talk, but that poor person then has to go away and walk the walk and actually do it. So I try to concentrate on what I call the bleeding obvious. And, we must all do the basics. And for the vast majority of people, all this basic stuff done really well gets you an awful long way. But better than that, as I call it, it clarifies those muddy clinical waters. Because people come to me with shopping lists of symptoms. And sometimes I don't know if this is going to cause that or if that's going to cause the other. But when you put in place all the interventions, then cause and effect becomes much more obvious. And then people then become their own doctors. They become their own detectives, because being a doctor should be like a detective. Then we get the symptoms, which are our clues, and then we put in place various interventions and see if those symptoms improve. If they don't improve, we've got the diagnosis wrong. We have to go back to base. But doctors don't think like this. They don't think causation. And so what it's important to do is we all have to become our own doctor. We all have to be interested in self, and nobody's going to be better motivated and nobody's going to be in a better position to do it than self, because there's only one person that puts food in your mouth, there's only one person that does your shopping and your cooking, and there's only one person that observes those symptoms. And I've, after 4.5 decades of going up every blind alley possible, I'm now descending on the bleeding obvious, and we all need to do that, and that will get the majority of people an awful long way.
Well, I think in conversations like this, we have to be careful along the lines of what you're saying, not to make it too costly if we don't have to, and not to make it too complicated, because people are just going to turn an eye and not get started. So
Correct.
Let's take it the other way as our final question here. The opposite of bringing in things like methylene blue and creatine. What is the simplest formula for people? We've shared a lot here over the last 90 minutes. I'm sure ketogenic diet is going to be the foundation, but what is the simplest protocol somebody can adopt today
Correct.
to get that momentum?
Well, ketogenic diet, and then take vitamin C and iodine to sort out the upper fermenting gut, because that is so common. And if you've got an upper fermenting gut, then you will malabsorb nutritional supplements. So ketogenic diet, iodine and vitamin C to sort out the upper fermenting gut. Then we all need a basic package of nutritional supplements, which is a multivitamin, a good multimineral, vitamin D 10,000 IU a day, vitamin C 5 grams a day, iodine, Lugol's iodine 3 drops, which you already started on. And then time restrict eat. Consume all your food within a 6-hour window of time. And if you've got the energy in parallel with that, we all need to be strong. We all need to do some exercise, which benefits in so many ways. And you don't have to be a jogger, just simple isometric exercises that should become part of our daily routine. And all that done really well is going to get the vast majority of people a long way. Keep it simple. Oh, a big pardon. And we should all be doing detox regimes. Think heavy metals and MSM for the heavy metals, and then some sort of heating regime. So if you're a runner, then just going for a little jog and showering off afterwards, fantastic. If you're not a runner, Epsom salt baths, fantastic. And we can all do that. So these are all things that can be incorporated into our everyday life. They're the most frictionless interventions I can think of, and all affordable, all intrinsically safe. The potential for harm is effectively zero, and just essential for us all to do.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
For insulin to work, it's got to have some essential cofactors. Things like chromium, carnitine, vitamin B3 and vitamin B1. We can have insulin resistance because the insulin receptor is blocked.